Hey, men, have you thought about bariatric surgery, but that's where it ended? Gentlemen, I'm talking to you. In a world where a lot of men don't talk about personal health issues, particularly bariatric surgery, Henry from my private Facebook group steps forward to share his story. You don't want to miss it coming up.
ProCare Health offers easy and affordable solutions with once-daily multivitamins, including our new DS and SADI surgery formula, increased iron, A, D, E, and K. Still just one capsule a day. Visit ProCareNow.com and use code Susan60 to get a free bag of protein powder with $60 purchase.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 90. I'm here to help you cut through all the health hype and give you accurate, evidence-based nutrition information worthy of your time and all of your efforts. Simple, step-by-step strategies that change the way you live your life now. I want you to feel well every day. Get out there. Do the things you want to do. This Bariatric Surgery Success podcast is for you. I want to give a shout out to Becky, who said, enjoying your podcast, and I love how you pack in the information in a short amount of time. Becky, it always makes me smile to hear you love the podcast. I value your time and I don't want to waste it. Thanks for listening. I've always felt that men are underrepresented in the bariatric surgery world. The stats for surgery skew heavily towards women, even though there are equal rates of obesity among American men and women. Of the surgeries performed, did you know that about 80% are women and 20% or less are men? Why is this? Stigma? Bullying? Are men not as aware of their health issues? Lack of support? Joining me today from California is Henry Baker, whom I met through our private Facebook group. When I read his story and his desire to share it and empower men to consider surgery if warranted, I asked him to join me today. Welcome, Henry. Thank you for offering to come on the podcast and tell your story.
Hello, I'm super excited to be here.
Yeah, I'm excited you're here too. Okay, I just want you to start out and just briefly give us a synopsis of when you were sleeved and your story.
So I was sleeved in December of 2020. Since then, I've lost 130 pounds.
Fabulous.
Yeah, and I think that it's been relatively a great ride. It's been a lot of good. Obviously, we all know that there's some ups and downs, some plateaus, a lot of good moments, a lot of, non-scale victories. And it's changed my life.
So Henry, let's go back to the beginning. I'm sure you had thought about this for a while before you had surgery. So I want you to go back to what held you back from having it? How long had you been thinking about it? Was it on your mind? And what was holding you back?
That's a great question, because being a guy, what's held me back is it's the pride of I can do it by myself. I can work out. I can eat good. It's that whole shame of I have to tell my wife and my kid that I can't do this. I need extra help, and that's what's been holding me back.
And do you think that's typical for most of your buddies, for guys, that's what holds them back from whatever it happens to be?
Yeah, I think it's typical for most of the guys that I talk to. It's a lot of that shame of I can't do it out of my own. They don't, men don't really share as much as women do. So there's that, I'm in my own little cocoon and I have these feelings, but I can't share them, can't get them out.
So were those feelings, Henry, is that what held you back? The same thing?
Yeah, that's exactly what held me back for a long time, really. Yes.
And before you had your procedure done, did you feel like you were very alone? Was it hard to talk about it? And then leading up to what was that turning point? I'm going to call it a aha moment when you said, you know what? Boo, I'm going for it.
Yeah. Before that, I felt like there's, one of the things that people always say is when someone has surgery, they change. I don't believe that they really change that much. I feel like they have their personality within themselves, but they're cocooned in that personality. And as soon as that weight comes off, that personality comes out and enhances themselves to the rest of the world and their friends and family. And that's where people think they change. in my case, yes, I felt like I was like my personality was there, but I couldn't get it out. I was in my own little cocoon, my own little cage that I put myself in. The thing that really turned it for me though was I one day I just sat there and I just said to myself, I'm 365 pounds. I'm closer to 400 pounds than I am to 300 pounds, and this is not working. What I'm doing is not working. I need to make some changes in my life.
That's
So I
very
sat down.
brave. That's very brave.
Yeah. So I sat down with my wife and daughter. I explained that to them, and they are so supportive. It was the best moment of my entire journey when I talked to them, and they were very supportive.
That's great. Was it hard for you to find, when you started looking around for a surgeon, was it hard? Were they as open to you as a man? Did you feel treated differently, or was it just matter of fact?
I think no, I don't think they really treated me any differently. I think I went to a surgeon who has lots of experience with, with lots of women, obviously. But I talked to him specifically about the men thing, and he said he's done men, and men have been very open to listening to what he has to say, whether it's, him, his nurses, the nutritionist, the psychologist I talked to. They were all very open to helping me create a better me.
I love that. Oh, I love that. That's wonderful. Did you, before you had surgery, work with a psychologist or a dietitian?
I did. I talked to a psychiatrist, and she explained to me like what was ahead, as far as the pre and the post op situation. And she wanted to make sure that I was okay with, just where I'm at in my head, that my head was like for me and not for other reasons. And so I was very open to that. Yeah.
Would you say that one more time? I think what you just said is invaluable. It's such a valuable thing where you just said she wanted to make sure about your head.
Yeah, she wanted to make sure that I'm doing this for myself, that I'm doing it to better my life, and not that I'm doing it to look better just for whatever reasons, or for someone else. She wanted to make sure that I'm okay and that I'm of sound mind, that I'm making this decision and I'm happy about it.
And when those questions were asked, did it make you think? Did you have to have a little go inside and ask yourself these questions?
I asked myself these questions as soon as I made the decision. That's when I asked the questions. So when she asked me those questions, this is 100% what I want to do. And once I put my mind to something like this, I just go for it and I just do it. All the contemplating was done beforehand.
Good. So when you first came through surgery, what was the toughest? So post-surgery, whether from the hospital on, what are some of the toughest moments that you faced? Did you ever stop and say, why did I do this?
Yeah, the toughest moment for me, and I can honestly tell you, this was the toughest moment. I sat there, and it was during COVID. So, you're in your room by yourself, and I sat there right after surgery the next day, and I have all these bandages, and I'm not feeling good. I'm very hungry because you can't eat and whatever. You can't eat or drink for 24 hours. So, but the nutritionist came in, and she sat at the door, and she couldn't come in. And she's like, I want to see how you're doing. I want to talk to you about making sure you're okay and get you on a right nutrition plan. And even though she was there, she really wasn't there. I was by myself, and I was like, this is not comfortable for me. It's something new, but I made this decision and I'm moving forward. And it was just a hard moment for me.
And what did you tell yourself, and what made you push forward? Obviously you have a tough mindset, and you decided that this is it, and this is what I'm doing.
Yeah. So from there on, I just said, this is what I'm going to do. I did go to culinary school. So I'm going to work on my diet. I'm going to start working out because I loved working out in the past. I just had some health issues that I take care of. But, the commitment to the eating and the working out and changing the mind is the biggest part. As soon as I changed my mind to have the surgery, that's the day I changed my mind to move forward with everything.
That's very powerful. I love that. Now, before I'm going to hit culinary school in just a minute, so don't forget,
Yes.
but I want to say something that I think is so important that you said to me that your biggest gain from all of this was that you had COVID after surgery and after you lost the weight. And if you had not gone through this procedure, you don't think you would be alive today. Tell us more about that. That's a strong statement.
That's true. I know that most people, when they find out they have COVID, they get scared, they get mad, they get sad, they get whatever. And not for me. When I found out that I had COVID, I just sat there and I just smiled and I said, I am so grateful that I lost this weight because my father actually passed away from COVID, and this could be my path too. But I lost the weight and it did save my life. And I got through COVID. I was sick for a couple of days. I was quarantined for like 6 or 7 days, but I knew that I was feeling better about myself.
Yeah, that's very powerful. Okay, your lifestyle changes. When did you go to culinary school? Have you done that in the past, or was that a change that came about after surgery?
I went to culinary school probably 10 years ago, and I was doing some catering back when I lived in Chicago for a while. And then I came to California, and now I just, do like small catering things. I do some cooking classes and like just nutrition classes too.
So you're really being able to take what you learned and apply that into the bariatric lifestyle of what I want to say my favorite thing is real food. I believe in real food. Once you're back and through those phases, I want to see people eating good, tasty, real food. And having been to culinary school allows you to do just that.
Yes. The thing about the culinary school, the background, the experience, and my wife and daughter are pescatarians, so we have experience. I have experience cooking lots of healthy whole foods, fish, and things like that. So I think that really set the tone for after I had the surgery.
Yeah, that's terrific. And I know you told me that you just had surgery for skin removal and a hernia just a few weeks back. So what made you go to that? Hernia, I understand, but did you have to really think about your skin removal? Did you talk to plastic surgeons on that? How did that decision come forth?
Well, so obviously we know we lose a lot of weight. We have a lot of the extra skin that's just sitting there. And for me, the time period between my sleeve surgery and the skin removal surgery, that's the hard part for me because I felt like I lost a lot of weight, but because the skin's there, you don't really see a lot of difference.
Yeah.
You know what I'm saying? Because that's so.
Yes.
So once I had my start losing weight, I talked to my doctor and I said, I have rashes, I'm having scars, I'm having bruises down under where that extra skin is. Can I document that so we can get that going? So we did that. We documented that. I actually had the insurance pay for the hernia repair and the skin removal, which is great. After the skin removal, I felt so much better about the way I actually looked. It wasn't really about the, I don't know. I guess just the skin had to go.
Yeah. And it just furthers you along in your journey. It's really part of the whole thing. And for you, I can see that it's made a great big difference. I think that's fabulous. So I want to hear, where are you now? What are you doing? What's Henry all about these days?
Okay. Once I started losing the weight, the first 9 months of my journey was very alone. I didn't have anyone. My wife and daughter, obviously, they supported me, but they don't understand because they didn't go through it. So, but once I found social media and I found people like you that I can ask questions and I can see that what I'm going through is normal, or what are the good parts, what are the bad parts, and whatever. I found a bariatric retreat that I went to in November. That opened my eyes to the entire community of the bariatric community. I really decided from there that my new purpose was to get involved in this community with my cooking. So where I'm at today is I'm going out to a lot of these conventions, talking to people, figuring out where they're at in their journey and what are they regaining, why are they regaining, what they can avoid for people going forward, that the new people that are getting their weight loss surgeries, and helping them get on the right path right from the beginning, so they don't, slip up down the road.
Yeah, that's so important. I love that very much. There were two things you told me that made a very big impression on me when we were discussing about you coming on the podcast, and you may not even be aware, but one of them was you said you have to actively participate in your success, which you have clearly done and are doing now. And number two, that changing your mindset begins before the surgery date, which very clearly you did as well. As we wrap up, Henry, what is the message or the messages that you want to send to other men right now today?
The message that I would like to send today is it's okay to get out there and start talking to your loved ones and or your doctors about what are my options, what can I do to help myself get better, to improve my life. I mean, the life that I had when I was bigger, it was very hard. I mean, it was physically hard, it was mentally hard, but once you make the change frees you, not just physically, but also mentally and emotionally, to get out there and achieve your best self and continue your best life going forward, no matter what age you are and no matter what gender you are. But the biggest thing for me is that make up that mind, find people that, find support groups that are the bariatric support groups. They will encourage you. They will help you. If you have questions, they've been through it, whether it's pre-op, post-op, they will get you and we will find you and we will help you.
Well, you heard it right here from Henry. Henry, thank you so much. I just so appreciate that you were willing to come on and be so transparent with your life. I hope you'll come on again sometime.
Absolutely. I'm going to do some research. I'm going to create a bariatric cookbook for people for a specific way of eating from the beginning to avoid the bad stuff down the road. Somewhere in the middle, there's a gap there, and I'm going to fill it.
Well, you let me know when that comes out, okay?
I will.
Thank you so much. And remember, Henry's Facebook and Instagram information will be in the show notes so you can be sure and connect with him. I hope you have a great week. Take care of yourself. You're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.